Do I have something fun to discuss? So the Menopause Society just came out with a statement on the misinformation surrounding hormone therapy. They start out by saying that we heard, this is talking about their recent conference, we heard a consistent theme of concern, alarm, and frustration from members about the significant increase in misinformation and disinformation promoted by some healthcare professionals. And then they go on to reiterate that hormone replacement therapy is only appropriate for certain conditions, including vasomotor symptoms, GSM, as well as the prevention of bone loss and reduction of fracture risk. That's important. And then they go on to say all the things that it's not important for and how most women don't necessarily need hormones and there's a lot of women who don't need them. I could argue about a lot of things in this, but the one thing I want to say is most women after menopause are at risk. Most, if not all, are at risk for bone loss and eventually osteoporosis and fracture. Even if we didn't look at any of these other guidelines, if we just said we're prescribing hormones to prevent bone loss and reduce fracture risk, that basically applies to all menopausal women. Even if it was just bone loss, that's still worth it because nobody wants a hip fracture or a spine fracture or an arm fracture. Osteoporosis kills and mangles women every